Welcome to Just Go Grind, a show that focuses on helping you launch and grow a business and navigate the ups and downs of entrepreneurship. I'm your host, Justin Gordon, and in this episode, we have Dr. Sophia Yen, the co-founder and CEO of Pandia Health, the only doctor-led, women-founded, end-to-end solution for birth control. And in this episode, we go through how she's building a brand to serve the needs of women, going through how she started the company, how they've fundraised, the business model behind Pandia Health, how technology now gives women the ability to essentially turn off their period, and so much more discussed in this episode. If you have an active prescription at a pharmacy or you have a doctor send it in, the delivery service is actually free with Pandia Health. And if you need a prescription for Arizona, California, Florida, Texas, Wyoming people, Pandia Health provides a doctor consult for $20. You can enter code JustGoGrind for $5 off your telemedicine visit. If you have insurance, the medications are free, no copay, no deductible. If you do not have insurance, most pill packs are around $15. As always, the show notes are at justgogrind.com/podcast. You can support the show by leaving a rating and review over in Apple Podcasts. Without further ado, here is Dr. Sophia Yen, co-founder and CEO of Pandia Health. Dr. Sophia, welcome to the show.
Thank you so much for having me. I'm excited to be here.
Yes, and so great to have you on. And I like to start with an overview of the companies first. So tell me a little bit more about Pandia Health.
Yeah, so about 6 years ago, I was giving a talk to a bunch of doctors. Why don't those pesky women take their birth control? What is their problem? And one of the top reasons was they didn't have it in their hand. They didn't have time to freak out, and they do freak out every single month about running to the pharmacy, getting their medication, and coming back home. And we forget that you have to do this for 20 to 40 years of your life. Run to the pharmacy, get your medication, but also have this nagging subliminal always in the back of your head. If I don't get to the pharmacy by the end of the month, there will be a dire situation. And so my friend Pearl and I were like, we can solve this. We'll just ship it to women and keep shipping it to them until they tell us to stop. And this way, women will never run out of birth control on Pandia Health's watch. And then when we ran ads for free birth control delivery, 60% of the women that responded didn't have a prescription. And I'm like, do you not know in the United States you need a prescription for prescription birth control? But these women came. And as an entrepreneur, I was like, I don't want to miss out on 60% of the customers. So I'm a doctor. I can write prescriptions. And thus, Pandia Health was born, the end-to-end solution for birth control from an online doctor's visit if you need it. If you don't need it, we're happy to just do the delivery, which is what we were originally founded to do. And we'll send you a month, 3 months, 6 months, a year, whatever you're willing to pay for, or we bill it to your insurance. And under the Affordable Care Act, no copay, no deductible for any FDA approved birth control, as long as you're not like demanding, I want this name brand when there's a generic available. And that's Pandia Health. Came up with the name, chose specifically, we're about women's empowerment. So Pandia is the Greek goddess of healing, light, full moon. And then I made up the definition. I think it was fate. This company needed to happen. Pan is every and Dia is day. So we have you covered every day. Set it and forget it. Let Pandia worry so you don't have to.
Well, that's about it. That's perfect. I love it. That's so great. It's such an easy kind of convenient thing for women, which is always needed. I mean, it's amazing how many products and founders have had on where it's like, wait, why did this not exist before?
Yes.
And just like, it's amazing. We're in 2020 and some of these companies haven't been around. And to that point, when you were testing this out, I mean, did you know right away, like, let's just get this in front of people with an ad and see if people would even click through? Like, how did you decide to test it with ads immediately?
Yeah. So that's the beauty of ads is you can run, Google AdWords and see what people click on. You can also do it on Facebook. You can do it on Insta. You can do it with a very low budget, right? And then the other part was polling women. So we sent out a survey to 100 women aged 25 to 35 who were currently on the pill patch ring to see what are your barriers to getting birth control. And one of the top ones was ran out of my medication, prescription expired. We take care of that with the online doctor's visit. Pharmacy has inconvenient hours. We're 24/7 because, you can text us, you can leave us a message, you can do whatever you want, but it's once you set it, it's set for the next year until you tell us to stop. And then the other one that I think is rarely seen is when you ask a patient or a customer, do you want this service? 85% said sign me up now or yes. And that's because why go to the pharmacy and risk at this time getting infected by COVID, somebody coughing on you? But also women face sometimes, slut shaming. It's just like when a guy goes to get condoms, right?
Yeah.
If your boss or the checkout lady or the pharmacist is like, Sophia, you here again for birth control, right? And then the whole neighborhood knows because Chatty Nancy behind you is like, oh, Sophia was at the pharmacy and for birth control.
And Sophia, with this as well, so that was you were able to test this pretty easily because if people don't know, like I said, ads are such a simple and really cheap way to at least gauge demand from like an initial product. And something like this, for instance, you have such a great reaction to this. I mean, what were some of the first things you did then to make this into a real company? I mean, it's been around 4 years or so now. Like, what were some of the first things you did to get it off the ground?
Yeah, so for me, it was really important to put together all the elements of the team and to do it in a safe manner. So the original founding team had myself, a physician, had a COO, my sorority sister, to handle anything that I didn't want to handle or that she's just very anal retentive and could do everything and do the Excel spreadsheets and lay out everything. We had our CTO, we had our head of marketing, and we also had Perla, original founder / advisor. And I don't know if I mentioned pharmacists. So we are the only women founded, women led, the only doctor led company in birth control delivery because we felt it needed to be women founded, women led. And I love to say, I live, breathe, eat, and prescribe birth control. So I have skin in the game. I know the product, I know the market, and I have 2 daughters. So I'm doing this to make their lives better. I'm doing this to make anybody with a uterus's life better so that they don't have this extra burden on their brain. I actually coined the term pill anxiety, and I've never heard it used in medicine, but once you say it, you totally get it. If you imagine a pack of pills with 4 rows of 7 pills, and as you get to that last week, if you don't get to the pharmacy, there will be a dire consequence. And women suffer this every month for 20 to 40 years of their lives.
In the initial stages of this, so when you had the ads to test it and then you built this team around it, did you kind of do the same thing to get the word out as you progress in terms of just more like a customer acquisition strategy through advertising, or how has that evolved with Pandia Health as you've gone along?
Yes. So, I think, as I mentioned, and as you've suggested, it's easy to get out a little bit through ads, but it is very pricey. And so, one advantage we have is that I can create content like no one else because I've been doing birth control and reproductive rights for 20 plus years. And
Helpful.
yeah. So if you look, we have a ton of Q&A. We have a ton of frequently asked questions, many blogs. We have 200,000 views on some of our views on YouTube with no promotion whatsoever because we know the questions that customers ask and we answer them. And I know the stressors that women have and we try to address those. So it's speaking to women, but also having that domain expertise that no other company has.
Yeah, that's the advantage of the team you've built, obviously, is having that domain expertise. And if you think about on the SEO side of things, like the long tail and these different queries that women would be asking, you have such a grasp on that from your experience that then you answer these questions. And then on the content side, obviously it's working really well. And that can be a much cheaper acquisition channel than doing paid, especially because then people come back again and again for years on the SEO side of things.
Yes. And at Pandia Health, we're starting with birth control, but our plan is to grow with women as they grow. So we are building the brand that women trust. And we feel, again, as the only women founded, women led, the only doctor led company, that we have the credibility and the expertise to do that.
And with that, Dr. Sophia, then how are you looking at what are the next products to offer, or how are you prioritizing them? Because there could be a number of different ones. How do you look at that?
Yeah, so my background is adolescent medicine, and I'm board certified in adolescent medicine. I'm a clinical associate professor at Stanford. I'm on the American Academy Pediatrics section on adolescent health. So, adolescent health is sex, drugs, rock and roll, a little acne, and a little sports medicine. And so, I love the reproductive health aspect. And then the next step would be acne, very easy to do. And then I'm on the older menopausal side. So all my friends are pushing for menopause and wrinkle cream. And the interesting thing is that menopause and wrinkle cream, exact same medication as birth control and acne, just different dose. So the contraindications for that, or the things you got to look out for, and you shouldn't prescribe people this medication, smoking, history of blood clots, breast cancer, liver, are the same. And so we can actually repurpose the questionnaires that we use for birth control, add a couple of nuanced questions for menopause, and whip that out quickly.
Yeah, it makes it so much easier to develop products that way, and to get that feedback directly from customers to figure out then what you need to create. And one thing I want to go back to with Pandia Health as well, on the funding side of this, when you had this idea, I mean, how early did you end up deciding that, okay, we're going to need funds to really get this off the ground?
Yeah. So, as many startups, you know it's a startup and you're going to have to suck it up for the first couple of months. But we did lose one of our original founders because she needed a full salary to take care of her Palo Alto house and her kid, and
Yeah.
you can't live in the Bay Area without a two dual salary and a high paying two dual salary. And so unfortunately we lost her early on. We had to part ways because we only had 5 to 10 customers to begin with, so we couldn't justify a full-time pharmacist. And so we knew we had to just suck it up. And luckily for the beginning team, we were able to suck it up for like the first 3 months. But then we had to immediately get some angel investors in. And then, of course, put in my own skin in the game and then hit up friends and family. So, as I like to say, I would rather die than not pay back my investors because they're family. And if you don't pay back family, it's deeply embarrassing. But I am highly motivated to pay back all of my investors. But the caveat is, again, as the only doctor founded company, we will always tell you what's best for your health. Even if it doesn't benefit our bottom line, we will make money for our investors. But we don't
Yeah.
have to do it by pushing something that's not in your interest or withholding information from you.
Yeah, and that's obviously great to hear. And what is then the business model behind Pandia Health as well, Dr. Sophia?
Yeah, so the business model is the same as any other pharmacy. The difference between the price that your insurance will pay for it and what we can source the medication at. And the beautiful thing about birth control is once you start, I know when you're going to need it for, the next 20 years, and I could literally ship it to you, meaning put it on a ship, because I have 3 weeks to get it to you.
Yeah.
And so the overhead and the warehousing is less because I can order it, get it in 3 days, and then ship it to you. Not by ship, but we use the US Postal. And I love to say, nor rain, nor sleet, nor snow is going to block your birth control because we use the USPS.
That's amazing. And making sure that people will definitely then get their product that they need, obviously every whatever their cadence is, depending on what they
Yes.
need. But and with that as well, then, so as you going back to the fundraising point for a second there, you raised a couple $1 million. You mentioned the angels. Did you take on institutional investors as well then?
Yes. So the first round, friends and family. Then the second round, I've been blessed to have several incubators, accelerators under my belt and supportive of me. So, Women's Startup Lab, which is, a women's startup accelerator based in the Valley, very unique in that you live there for 2 weeks, very intense. And then Springboard Enterprise, a group of very powerful women, mainly in the East Coast, but now that they've expanded into healthcare, health tech. And then lastly, StartX, which is Stanford's startup accelerator. And at the time, they had the StartX Fund, which is they would match 10% of every round through Series A. They've since closed the fund, but being able to start out and say, Stanford's in for 10%, you want to join the game? So,
Helpful.
and then got Charles Hudson of Precursor Ventures. Love him, love his
Yeah.
team. They are just, it's an honor to be with all the companies because every company he touches is beautiful and magical. And he's just a great guy. And Sydney, his second in charge, is amazing. And they're just good people. And then Electus Capital out of New Zealand / Australia has been huge. And that came through a Springboard Enterprise contact.
Yeah, I just want to vouch for Charles as well. He actually signed up at some point. He's gonna be on the show. I know he's already agreed to it. He's awesome.
Great.
He's invested in a number of companies I've interviewed. Very early stage, obviously, very early stage, but he takes those
Yes.
risks in the founders. And I want to say it was Zuleika Strassner from Zero who just raised a couple million. She had him as one of her early investors, and she also raved about him as being just a fantastic investor and person to know as a friend as
Yes.
well, which is great to hear because there can be investors who are not that way. Let's just say. And with that then too, so once you had raised the institutional round, then I'm curious as like what the use of funds was that mostly on the team side of things, or what was that for?
I would say that the team has stayed solid for the past 4 years, and I really like this team that we've built. We have switched out the COO. We've homegrown our marketing. We tried farming out the marketing, but the beauty is we had somebody who understood social media within. So our head of marketing has just been great at producing content. So we'll take a video from a Facebook, Instagram Live, chop it up, put it on YouTube, transcribe it, put it on our blog, and then do little clips for ads that we can do as well on Instagram or TikTok. So it's just, she's been amazing, and I'm really proud that she has risen to the occasion. We've spent a lot of money on customer acquisition. As I mentioned, Facebook, Google AdWords is expensive, and more competition enters the market. But luckily, from our organic, 70% of our customers come through our organic.
Wow. That's incredible. And on the organic side, then diving just a little bit deeper into that. So repurposing content is a huge strategy, and it makes a lot of sense if you can do it. I'm curious as to how you think about the cadence of content strategy, as that's a huge part of your business in terms of, I mean, thinking about we need to just produce a video every week, every day. Like, how do you go about like strategizing on that?
Yes. So I think we just had a ton of content in the beginning because I am a Quora top writer, and
Oh
I've
yes,
just
love
been
Quora.
I've been answering questions about birth control, for the past 20 plus years, and I went to MIT, so I like technology, and so I was answering, I forget, it was Yahoo Answers or whatever, Ask Jeeves. So
Jeeves,
I
yeah.
have all these answers to all these birth control questions, and I was like, if I wrote them, they're my property, so we're just going to throw them all on Pandia Health. And so we seeded it with a lot of the Q&A and the frequently asked questions. And then we chose blog pieces. We're trying to get out, 1 to 3 blog pieces a week, depending on if we have interns. We really like marketing interns, journalism interns, as well as pre-med interns, because then they can do it from the doctor side, and we can make sure that our information is medically accurate. In terms of video, we're doing once a week. And in fact, today at 5 o'clock Pacific time in Espanol, and then at 5:30 in English. I think I'm one of the few, I'm willing to take on any birth control CEO and have a Spanish battle. And I'm pretty sure I'll beat them.
I love it. And we'll see if anyone takes you up on that, Dr. Sophia.
Yes, the gauntlet is thrown. I took
I love
10
it.
years of Spanish in public school and 6 years in public school and 4 years at MIT.
That's amazing. I love it. And one thing I want to talk about as well is thinking about kind of current times. We're recording this in October of 2020, the whole telemedicine, how that's evolved with COVID. How has that impacted Pandia Health?
COVID has been a boon to telemedicine and delivery. Those are the two hot areas that are surviving in this startup world, in this remote world. And I just think it's really important for people to know, from the physician point of view, the limitations of telemedicine, and to make sure that you're getting quality telemedicine. So if you're going to your regular doctor and they've switched to telemedicine, I assume you looked into the credentials of the doctor that you originally chose. Go right ahead. But if you're choosing between two companies that you don't know about, one, Who is the CEO? What is their interest? Have they taken the oath, do no harm? Because I have. And again, we're the only doctor-led company in birth control delivery. 2, are they providing informed consent? Because if they're not run by a physician, they may not know the standard of care is to provide the same care to the best of your ability that you would provide in your office. But more importantly, a huge tenet of medicine is informed consent, which is I have to give you all your options, not just the options that make me money, because as a doctor, I can write whatever prescription you want to whatever pharmacy I want. From the pharmacy side of my company, I can choose only to fill the ones that I make money off of. But during your telemedicine visit, I should offer you the pill, the patch, the ring. And if I omit some of them, and you may want to check some of my competitors, then that is not standard of care. And that is not informed consent. And never have I been in a doctor's office where they're like, do you want this specific drug? They're like, do you want a, cholesterol lowering drug? Do you want a vaginal ring? Do you want a pill? Not this name brand drug. If your doctor's doing that, that's not standard of care. During a telemedicine visit, if they're like, you want this vitamin? Vitamins are not FDA approved. They're not run by the FDA, to my understanding, or any supplements. And therefore, as a physician, we will say, you need some vitamin D, you need a multivitamin, but I won't be like this specific brand, right? And then it should never be opt out. It should always be opt in. And the example there is, I'm going to give you this female condom unless you say no. You qualify for a free female condom, but did you ask for it? Did you really want it? And did you actually know what a female condom is? Because in my 20 plus years of medicine, I've never met a heterosexual female that uses the female condom. So certainly, 1 in 100, 1 in 1,000, but not like 30% of your customers getting a female condom.
Dr. Sophia, on that note, with the providers, I'm curious, how did you go about these partnerships with it? Because obviously you're talking about the standard of care and everything. Like on the provider side, how did you go about these relationships and these partnerships with them, especially early on when you were just kind of getting started with this?
Yes. So our model is different in that these doctors are working for Pandia Health. We are not they are contractors, but it's not like a partnership. Like we found this private practice and we're making friends with them. It's more, I'm recruiting you to join the team that's here to make women's lives better. We're about care, convenience, confidentiality, and access. And do you want to join this team that's the only doctor-led company in this space that you can trust us, that I'm not going to screw you and you're going to lose your license? And so we are well lawyered up. We have a telemedicine doctor lawyer. We have a pharmacy lawyer. We have a non-conflict of interest between pharmacy and doctor lawyer. We have a startup lawyer, because as a person who had to go through med school, residency, fellowship, and has an academic title, I will not lose my license, and I do not want our company to get sued.
Yeah. Yeah, I feel like that's probably pretty important, Dr. Sophia. Oh, goodness, there's a lot at stake there, at least when it comes to that, obviously, which is why you have just mentioned these number of different people on the team as well. And with the team side, as the company has grown, how has that evolved in terms of who you're looking for, in terms of teammates and like the culture fit for Pandia Health as well?
Yeah, I think culture fit is important. If you're anti-birth control, not a fit. If you're anti-woman's empowerment, not a fit. That is our goal, is to make women's lives better. In terms of the team, we absolutely have had to grow from our one CTO to 2 others. We're really proud to have Elliot Blatt, 10X programmer, as we call him, and then picked up PCCN, my MIT alumnus. His wife wanted to invest in us, and instead of investing, she gave us him. And so he's a co-founder of Jigsaw, for those people who are in tech and understand that company, which sold itself to Salesforce. So it's an honor to have his caliber of programmer with his experience. He's also has HIPAA compliance experience, which is important for a health company, join our team. And then we've picked up a UI UX person, which is critical when you're doing a direct to consumer company. You want stuff to look good, to make sense, and to be easy to use. Our marketing team, as I mentioned, we farmed it out in the past. We've brought it in, and now we brought it in and supplemented it with, Google AdWords experts such as Upgrow. And then Sneha is a great contributor to our team, both in strategy, but also Facebook, Instagram. And then my chief of staff has just been amazing. She herself has Susanna Craig, one of the few, I think, Latina chief of staff or C-suite players, again, in birth control delivery. So we are diverse. We're about diversity, and we're about women's empowerment.
And one of the things you mentioned there, Dr. Sophia, is just going back to the point of kind of in-house versus outsourcing the marketing side of it. As you've gone through that, because I know a lot of other entrepreneurs are going through this kind of same thing. Do we have an internal team? Do we have it outsourced? Do we have a mix? How did you think through that process?
It's been experimental, right? We tried outsourcing it, and I think for the, organic, it should be in-house. For Facebook, Google AdWords, I've learned that, in the beginning you could learn it yourself and hack it yourself, but there comes a level and an expense that you want somebody who knows how to do it, knows all the little secrets and the tweaks that they've been doing for 5 to 10 years that your person may pick up or may not, but it's more cost effective to have somebody who really knows what they're doing. But you also need to, choose your teams wisely, that they aren't overstretched, right? If you're paying a little bit of money and you're only 10% of their mind share, or one of 30 companies, God forbid, not that we ever use a company like that, but it's definitely possible, then it's an issue, right?
Yeah, that becomes really tricky. To your exact point, like understanding the companies you work with, you're not the only ones in their lives, unfortunately.
Yes.
So you may not get all the attention for it, but I think it's a good point of one point that's always been made for agencies is like the experience they have across working with a number of clients. They get certain insights from that to then get better, obviously, at running campaigns, which you may not have from an in-house perspective, but they don't have the same expertise on the actual subject matter that you have in-house. So it is kind of a back and forth of deciding what route to go. And I've worked at an agency before, and I've interviewed people who have had both sides of that. There's no right answer. It is kind of testing, and at different stages of the company, it also evolves as well.
Yes.
Yeah, which there's so many decisions to be made, Sophia, of course, all the time. And on that note, kind of like today in the company, a few years in already, of course, what are some of the things you're mostly working on at this point, Dr. Sophia?
At this point, we're working at expanding. So currently, we can deliver to all 50 states, and we can prescribe in 5. So California, Florida, Texas, and then we added on Arizona and then Wyoming, simply because we had a connection that could get us there and up and going. And we want to be in all 50 states. And I'm sort of a control freak. So I was like, I want to own all of the medical groups, and then we'll expand. But a faster way to expand is to partner with a local private practice. I forgot to mention that, we specifically choose people that are passionate physicians, that are passionate about women's reproductive rights, women's access to birth control, and who have experience and academic credibility. So when you're choosing telemedicine, do they list the doctors on the website? Not the chief medical officer, not the picture of a female physician that they had consult on their flow, but who's actually writing you the prescription, who's actually thinking this through and looking at the side effects and there to help you when things go wrong. Because you don't want a algorithm per se doing that. You want a person who has 20 plus experience doing this. And as I like to say, I've written 2,000 birth control prescriptions in the past 2 years, and I've seen the side effects from it. And so again, as the only, I think, academic physician founded and led company in this space, I'm a clinical associate professor at Stanford, and I've written papers. And so I know how to do research and data and, compare the science. We're looking at we noticed that academically, most people write this birth control pill, and that's the one we were taught in med school was a good one. But when you actually put it in practice, we noticed that Latinas, African Americans, and Asians did better on this one. And that if you want to skip your periods, which we're trying to educate women about, hashtag periods optional, that this drug works better. And before we would prescribe the other one because it was cheaper and we were trying to save people money. But now the prices have all turned the same. So why give somebody this one that has more breakthrough bleeding and doesn't work for ethnic minorities as well compared to this other one? And then we're asking our customers to self-report their ethnic. So I like data. The more data, the better. So we break down not just Black or African American, we break down Asian, Pacific Islander into all the subgroups so that we can look at, is there a specific difference for Taiwanese, Vietnamese, for, France versus, Ireland versus whatever, and then a combination thereof.
Yeah, and actually, I interviewed someone this morning, an educational company called Guru. It was Scott Lee, and it's like the idea of just personalized education, personalized health, everything being personalized because everyone is different. Everyone learns different. Everyone reacts to different drugs or whatever it may be different. And I think as technology kind of advances, you see more and more people providing that in different spaces. And one of the things you brought up, Dr. Sophia, was this idea of like skipping periods and this idea of educating women around that. What would you want women to know? I mean, on that note, as you're kind of
Thank
going along
you
here.
so much for this opportunity. My passion is and new mission in addition to bringing birth control to wherever women have internet and a mailbox, and then expanding to all of women's health for their, as I call it, uterine lifetime from age 14. Well, you always have a uterus, but in terms of your uterus irritating you or bothering you or causing you something from age 14 to, 55 and even 60 and then on, is anybody with a uterus, if you're bleeding 1 week out of 4, we now have the technology to turn that off. And it will result in decreased endometrial, ovarian, colorectal cancer. It will result in less anemia, iron deficiency. The number one cause of missed school and work in a woman under the age of 25, her periods. And we can turn that off. The number one cause of anemia in a menstruating woman, menstruation. And so we can make those with uteruses' lives better.
On that note, Dr. Sophia, I mean, how are you innovating in the space or innovating within the actual, the kind of the products themselves, or what are you seeing within that as well?
Yes. So one thing we want to do is destigmatize birth control. And we want to make birth control no longer birth control. We call the progesterone only pill POP, but we call birth control pills OCP, oral contraceptive pill. And as soon as you put the word contraception, it has stigma, it becomes politicized, and that's unfortunate. But if we call it estrogen progesterone pill, EPP, then it has no contraception, it has no stigma. And to realize that 70% of women using the birth control pill use it for non-contraceptive benefits in addition to contraceptive benefits. And one of them, as I mentioned, is horrible, painful periods, heavy periods causing anemia, acne, polycystic ovarian syndrome, which affects 1 in 10 women. If you want to learn more, Google Pandia Health PCOS. There's a great talk I did for Stanford on it. And then endometriosis, mainly, there are so many things that, quote, birth control pills are used for that are not for birth control. And if the Affordable Care Act gets reversed and that coverage gets taken away, women will have an extra, I think it was either like 1.6 billion or $6 million burden because of that. And it's just not fair, that it takes 2 to tango, 2 to have sex. Why should the one with the uterus have to pay for all the costs?
Yeah, it doesn't quite seem right, does it, Dr. Sophia?
No.
I'm curious, just to take a giant step back. How did you decide to get into medicine in the first place, Dr. Sophia?
As a Asian American, my future options were, as they say, doctor, lawyer, engineer, but mainly because I like science. I find the human body amazing, all that it does, all the organs and how it all functions together and all the different cells and the immunity. And I find people fascinating. So if you just like science, get a PhD, work at a bench, do some research, one aspect of it. If you like people, then medicine is a great place to be because every person has their story and every person you can help with the knowledge that you gain as a physician, as a healthcare provider. So to me, went into medicine because I like science and I like people and I like the do good.
And from that, you've actually been a part as well of co-founder another number of different organizations in the past. I'm curious as to how all of that, so your experience early on combined with your experience at founding other companies, has influenced how you run Pandia Health.
I think that, you know, Pandia Health is the culmination of my career because I started helping people one-on-one as a physician. Then I was a professor teaching the future of physicians. And now Pandia Health brings access to any woman in the United States as long as you have internet and a mailbox to get your birth control. So it's growing bigger, helping more people. Also being, a founder of other nonprofit organizations as well as for-profit organizations, gaining that experience in those fields. So I was, treasurer of almost every organization in high school and college, and there was some serious financials for my sorority. I was VP of I think there was VP of disbursements, money coming in and money coming out. And so I was disbursements. But I've also done my parents' financials, their personal since fourth grade. And they had me train with their accountant. Yeah. So I'm very proud to say I balance Pandia Health's checkbook every month to the penny.
Wow. Wait, hold on. In fourth grade?
Yeah, it's basic method. It's addition and subtraction. And also a little calendar where you schedule the bills and you put in all the bills. And I still do that today. I have a daily calendar where I put all the bills and you can choose, random tip for everybody. You choose Saturday, Sunday, because that's when most of us get our stuff together. And you do it the week before the bills due. And you put all the ones that are upcoming on that day. And then on one day a week, you deal with it. And I'm very savvy with respect to money because my joke was not joke, but theme in high school, yen equals money equals treasure. So I like math. I like money. That's where the power is. And so schedule your stuff once a week, get a high interest earning savings account. I actually had somebody audit our books and they're like, you made like $5,000 last year in interest. And I was like, yeah, because I put it in an interest earning savings account and then I transferred it once a week whenever I wrote the check. And I was like, don't all the startups do that? And they're like, no. And I was like, that's because they don't have the accounting background that I have.
Well, now you shared this, so others will have that. So thank you, Dr. Sophia. I appreciate that. And also, what I'm really curious about is for other entrepreneurs interested in getting involved in whether it be telemedicine, healthcare, in this space in general, anything you'd say to them, any suggestions you make? And it's obviously you're running a very unique company with having doctors, physicians leading the way in this space. But for others interested, other entrepreneurs interested in getting involved in this space, what would you tell them?
I would say strongly consider having a physician founder or making sure that that person has skin in the game and is thinking of you 24/7. And that's the difference between a doctor founded, doctor led company than one who just hires a CMO who might be working part time for you because I'm living, breathing, thinking Pandia Health 24/7 and always coming up with new ideas, new products. And part of the startup life is always improving, always making things better. So when people ask me, what is the moat as new people enter the field? I have 4 years on you of asking patients questions, asking them correctly, asking the right questions. And also I've built the team of great physicians. We're very proud of our physicians. We list their first and last name, all of their training, and why they're passionate to work at Pandia Health. So make sure whatever telemedicine company you use that they list the doctor's first and last name. And if they don't, you got to wonder why.
Yeah, absolutely. And Dr. Sophia, what is kind of the big vision for Pandia Health the next, 5, 10 years and beyond?
Yeah. So, as I mentioned, we are building the brand that women trust with their health. And so, we're starting with birth control, but you can envision us growing with women as they grow. So, we can do pre and postnatal vitamins. We can refer you to our friend over here who does a breast pump. We can refer you over here to our friend that does infertility. And then, from the investor side, we have a box going to women's doors every month, every 3 months, every 6 months. And the woman's
Yeah.
like, thank goodness my birth control is here. And ooh, here's a new makeup. Here's a new cookie. Here's a new toothpaste. Here's a new dental floss. You may be advertising on Facebook, Google AdWords, Insta, but do they get to taste, feel, and try your product? We allow that opportunity. Right now, we're partnering with female founded, but female focused companies that have products, and we're sticking them in there for free. And our customers like, ooh, I love this new makeup. I love this new toothpaste. I love this new detergent. But in the future, you can imagine that we're going to charge. So we have
Yeah.
the woman for life. That is our goal, to be your buddy from age 14 until the end of time. And then to have a box going to your door every month, every 6 months. It's a recession proof subscription.
And I really like what you mentioned there with kind of you're basically leveraging what your strengths are. And your strengths are that one, obviously having a rock star team that then leads you to having women on board because they trust you. And once you have that trust built as well and offering something they need and they love every single month, it's like there's so many ways to grow beyond that, where you see some startups who don't necessarily have that same customer focus, or where customers are kind of obsessed with them. They're not able to do as much because they're not as flexible as you mentioned in terms of being recession proof of sorts, because you've really focused on the customer. I just wanted to highlight that point as well. And for you, Dr. Sophia, as a founder, what has been most helpful, whether it be a business or professional, business or personal, book that you would suggest to others?
There are so many books that I have in my bathroom. I can picture them right now. There's like 10 of them. And then I have little scraps of paper that I put in there to mark all the important pages. For really beginners, I love Jason Calacanis's Angel book. And
Yeah.
then there is the one, I suck with names and exact
Right.
titles, but the hard part of running a
Hard thing about
startup.
hard things.
Yes, thank you. Thank you.
Yep.
That one's good. And then by Robin Farman-Farmahian, which is how to build your kind of influencer brand. And then, of course, the Zappos book, Bringing Happiness. And we are about customer service. If you look at our Google reviews, I'm not kidding. We have 5 out of 5. And I don't say 5 out of 5 because no one will believe you, but it was 4.9. And 4.9 is what I put on the slide. But technically, it's 5 out of 5 if you look at the site. So I'm like very proud of my team and my patient care advisors that have been able to accomplish that.
Absolutely. That's amazing. And with having a startup and you mentioned because you're thinking of Pandia Health 24/7, how do you recharge or step away from work, Dr. Sophia?
Yeah, I don't necessarily suggest you do what I do. A lot of people do it a lot healthier. They do exercise. I am a absolute couch potato. I should do more exercise. I used to take a Pilates class, but then COVID, and then
COVID.
yeah, COVID,
Had
and I
COVID for everything is the
yes,
answer. Yeah.
is the answer of sadness. And
Yeah.
then the joke is on the East Coast, people go to therapy. On the West Coast, we get a massage. Again, COVID. And so I'm also an obesity expert, so that might be somewhere we'll go in the future. So, but food is not love. Time and money is love, is what I say. But I really do love food. So donuts, shaved ice, boba, but and then video games. We found some great group video games with our whole family. So it's my husband, myself, and my 2 daughters playing
Ooh,
Butter
nice.
Royale. We are absolutely addicted, but Ring Fit is a way to build video game plus addiction plus exercise is another thing to do, and taking time for yourself. So setting time aside, one, half an hour a day to do something fun, something that makes you happy. Oh, and then silly TV, right? Like Marvel and Supergirl and Fresh Off the Boat, Blackish, anything that's happy.
And there's so many ways to recharge. That's why I love asking entrepreneurs, because there's no right answer. It's just everyone has their own thing. But I find it fascinating to hear what everyone has, and whatever it may be. It's like, oh, okay, some maybe Zen and doing yoga every day. Some maybe
Yes.
doing very hard training. Like one person I talked to recently, because they run a health and fitness like company, and they're doing extremely like hard training, like Ironmans and stuff. I'm like, that's one way to go.
Yes.
And then everyone has their own story, but I think it's important that you find something, because this startup journey, even though there's a lot of obviously passion and excitement in it, it can be a lot to handle. Running a company and having the obligations of it, and you also have a family as well. So I think it's important to find something to recharge. And lastly, Dr. Sophia, is there any other advice, takeaways, lessons you want to share with other entrepreneurs out there as well?
I think it's important to build your support team. And one is within your team yourself, but two, amongst other entrepreneurs, so that you can commiserate or share tips. Like, I found this great SEO person. I found this great graphic designer. I found this great podcast host that's just amazing, and I love his podcast. JustGoGrind. And Jason Calacanis is group as well. And I found these great investors. So building that network, and that would be my advice. Also, always get everything in writing, and also realize that whoever you start this with, founders, co-founders, investors, you may hope to turn it around in 2 years or 5 years, but it might be a 5 or 10-year relationship. So this is like work family. And I consider it a family, that I treat my customers and my team the way I would treat my family, which may not be the nicest thing. So I may need to work on that and treat them nicer. My family can attest to that, my brothers.
I love that you bring up the point of finding that community and the support. And that's actually something that I haven't announced officially yet, but I'm going to be building a community essentially of founders. Yeah. And it'll be free, completely free for people. So that I'm excited to launch probably at community.justgogrind.com. Technically it's already live, but people don't know because I haven't said yet. But that will go live probably by the time this is, now I have to, because it'll be on this episode. So that'll be live for people as well. If you want to check that out, it'll be a community of different founders, potentially some investors I know as well who want to contribute to help out. But I think it's such a need for people. And it's kind of almost like I look at things as it's a disservice if I have this many founders in my network that I'm not connecting them to each other, or at least giving them that opportunity, as well as people who maybe want to ask a few questions. And so that's why I want to put that out there as well. And Dr. Sophia, where can people go to learn more about Pandia Health and connect with you as well if they would like to?
Absolutely. Thank you for doing that. I love that you're, paying it forward and sharing what you have to share. And that's the kind of people I love. And that's the kind of person that I am, that if I can help you in any way, absolutely reach out. I'm here to help. I'm here to answer any questions about birth control, periods, optional, or as I like to say, everything V. And you can find us at pandiahealth.com. We're on Facebook, we're on Insta, we're on TikTok, we're on YouTube. Any questions, anytime about birth control, hit us up. Of course, we prefer if you're one of our customers, so we're not just answering questions for other people. And we hope that you will spread the word about the only women-founded, women-led, the only doctor-led company in birth control delivery.
Love it. And thank you so much for what you're doing and for coming on the show, Dr. Sophia.
Thank you for doing this.
Thank you for listening to this episode of Just Go Grind. I really appreciate you taking the time to listen. The Weekly Grind, which is my weekly newsletter, comes out every single Friday. You can find it at justgogrind.com/newsletter. This is filled with tips, tools, and strategies for growing your business. If you want to know how to launch a business, how to grow it, how to get it off the ground, find employees, all these different things. There's a few tips, tools, and strategies every single week I deliver right to you. justgogrind.com/newsletter. Check it out. Thank you so much for listening. Talk to you in the next episode.